Here's what the doctors have to say about the extraordinary results they obtained with lung wash. A retired 51-year-old building contractor was suffering from severe asthma. In 1966, he was so sick that despite all therapy, he became severely breathless, turning blue, with severe mental confusion and rapid deterioration. His wife was explained that lung wash may be the only option. She agreed. After a lung wash with 3 liters of fluid, the patient improved so much that in just 4 days, he looked 20 years younger. His fingers looked healthier, the skin on his hands improved, and he said that he had never felt so well since 1952, that is, 14 years earlier. Vicente Garcia, who pioneered lung wash to treat various lung ailments from 1928 to 1936, exclaimed, "The patients do not have unpleasant sensations after the lavage, even if they had large amounts of fluids in the lungs. On the contrary, they report a feeling of euphoria after emptying the lungs." Researchers from New Zealand who performed lung lavage on asthmatic and COPD patients remarked, "The fact remains that some patients who underwent lung lavage, who were respiratory cripples with apparently intractable asthma, are now no longer crippled. They can lead a useful and active life and can cope with their asthma attacks more easily." In patients with bronchitis and emphysema, although there were no striking changes in their respiratory function tests, their exercise tolerance was improved and they managed to produce their sputum without the sort of life and death struggle they experienced previously. Status asthmaticus remains the primary indication for bronchial lavage, and some of our most dramatic and lasting results have been obtained in patients who were moribund, that is, on the point of death. A 57-year-old lady with severe ARDS and sepsis with extremely low blood oxygen levels was given a lung wash in just one lobe of her right lung with 500 ml of saline. A pinkish fluid with a large amount of thick proteinaceous material was flushed out of her lungs, and her blood oxygen levels rose dramatically, so much so that no further lung wash was required. Just 500 ml of saline pulled her out of ARDS and sepsis. A research paper from the 1970s even goes as far as claiming the effectiveness of massive bronchopulmonary lavage in the elimination of severe chronic obstructive pulmonary diseases. These diseases are currently not curable by any other form of treatment. A young pregnant woman was admitted with severe, uncontrollable, life-threatening asthma attack in the 20th week of her pregnancy with extremely low blood oxygen levels. She kept deteriorating despite all regular therapy. Just when the doctors were thinking of terminating her pregnancy to help save her life, they tried out lung wash with saline as a last-ditch effort to save her baby. Large numbers of small mucus plugs were flushed out, and her blood oxygen levels immediately improved. After a few weeks, she delivered a healthy male infant at 36 weeks of pregnancy. Every time I recount this story, my hair stands on end. This is the amazing, life-saving power of lung wash.